Can Medicare Advantage HMO PPO deny coverage as not medically necessary? Imagine needing a specific treatment and wondering if your insurance will cover it. If you have a Medicare Advantage plan, you might be curious about how coverage decisions are made. Well, let's explore how these plans handle requests for services and what it means when they say a service is not medically necessary. Medicare Advantage plans, which include health maintenance organization and preferred provider organization types, can deny coverage if they decide a service isn't medically necessary. These plans are run by private insurance companies, but they must follow Medicare rules. Still, they have their own processes for approving or denying services. Medically necessary means a service or supply needed to diagnose or treat a health problem. It must meet accepted medical standards. Medicare Advantage plans are required to cover all services that original Medicare covers, but they often need prior approval before paying for certain treatments. If they review a request and find the service isn't necessary, they can deny coverage. The difference between health maintenance organization and preferred provider organization plans affects how these denials work. Health maintenance organization plans usually requiring members to see doctors within their network, except in emergencies. They often need referrals to see specialists. If a service is denied as not necessary, members can ask the plan to review the decision through an appeal process. Preferred provider organization plans offer more flexibility. Members can see out-of-network providers, but usually at a higher cost. Like health maintenance organization plans, they must cover services deemed medically necessary. If they decide a service isn't necessary, members can also appeal the decision. It's a good idea to check with your plan before getting out-of-network care to confirm coverage and approval. Both types of plans follow Medicare rules but have their own guidelines and appeal procedures. If a service is denied, members have the right to challenge the decision through the plan's appeal process. This process involves submitting a request for reconsideration and, if needed, going to a hearing. In practical terms, if you have a Medicare Advantage health maintenance organization or preferred provider organization plan, you should understand your network rules and prior authorization requirements. Always confirm with your plan that a service is covered and necessary before proceeding, especially for costly treatments. If a service is denied as not necessary, you can file an appeal and ask for a review. Remember, these plans do have the authority to deny coverage based on medical necessity, but they are also required to give you a clear way to challenge those decisions. This system helps ensure you get appropriate care while managing costs. So, knowing your rights and the process can make a big difference if you face a denial.